Hi everyone, welcome back to my YouTube channel, and today we are going to talk about carcinoma cervix. So let's start our topic with introduction. Carcinoma cervix, commonly known as cervical cancer, is a malignant tumor that arises from the cells of cervix, that is the lower narrow part of the uterus that connect to the vagina. It is one of the most common cancer affecting women worldwide, particularly in low and middle income countries. Cervical cancer develops gradually, beginning with precancerous changes that are called cervical dysplasia, before progressing to invasive cancer if left untreated. Persistent infection with high risk of human papillomavirus is the primary cause of cervical carcinoma. Causes and risk factors. First is human papillomavirus. If there is persistent infection with high risk human papillomavirus types, especially HPV-16 and HPV-18, it is a leading cause for cervical cancer. Early sexual activity and multiple partner increase the risk of HPV transmission, and weakened immune system like because of HIV infection or immunosuppressive therapy can increase susceptibility for cervical cancer. Another risk factor for it is smoking, that is associated with higher risk of cervical cancer. And another risk factor is poor hygiene and lack of screening, that is because of limited access to health care contributes to higher incidence in developing regions. Types of cervical cancer. It is divided into three types. First is squamous cell carcinoma, second type is adenocarcinoma, and third type is mixed carcinoma. First type is squamous cell carcinoma, that is most common type that arises from squamous epithelial cells that line the cervix. Second type is adenocarcinoma that originates from glandular cells of the cervical canal. And third type is mixed carcinoma that contain features of both squamous and glandular cancers. Symptoms of cervical cancer. Early stages of cervical cancer are often asymptomatic. As the disease progresses, symptoms may include abnormal vaginal bleeding, that is between the periods and after intercourse or post-menopause. There is foul-smelling vaginal discharge. There is pelvic pain or pain during intercourse, and advanced cases may present with urinary or rectal symptoms due to spread. Diagnosis of cervical cancer. First we do is screening test, in which we can do is pap smear that detects precancerous changes, and it is one another thing that doctor can do is human papillomavirus DNA testing. At second step of diagnosis, doctor can do colposcopy, that is visual examination of cervix with magnification. At third step of diagnosis, doctor can do biopsy that confirm diagnosis by examining tissue samples. At fourth stage, we can do imaging, that is maybe MRI, CT, or PET scan that is used for staging and assessing spread. Staging of cervical cancer. Cervical cancer is staged using the FIGO system. In this, there are four stages. Stage 1 is when the cancer is confined to cervix. Stage 2 is when the cancer spread beyond cervix but not to pelvic wall or lower third of vagina. Stage 3 when the cancer spread to pelvic wall or lower third of vagina. And stage 4 is when there is cancer spread to bladder, rectum or distant organs. Treatment of cervical cancer. Treatment of it depends on stage, patient age and reproductive desires. Early if stages, a doctor can do surgery, that may be hysterectomy, conization or tracheostomy. In advanced stages, radiotherapy and chemotherapy can be done. Radiotherapy in this external beam and brachytherapy is done, and in case of chemotherapy, it is often combined with radiation. And third, we can do targeted therapy and immunotherapy, that is emerging option for resistant cases of cervical cancer. Prevention of cervical cancer is done by HPV vaccination, that is highly effective in preventing infection with high risk HPV strains. It can be prevented by regular screening, as pap smear and HPV testing detect precancerous changes early. It can also be prevented by safe sexual practices, as it reduces risk of HPV transmission, and smoking cessation is also done for prevention, and as it lowers the risk of cervical cancer. Prognosis of cervical cancer. Prognosis of cervical cancer depends on stage and diagnosis. Early detection leads to high cure rate, and advanced stages have poor outcomes due to metastasis. Global disparities exist, with higher mortality in regions that lack screening and vaccination programs. Conclusion of this lecture video. Carcinoma cervix remains a major public health challenge, especially in resource limited setting. With effective HPV vaccination, regular screening, and timely treatment, cervical cancer is largely preventable and curable. Raising awareness and improving access to preventive healthcare are crucial steps towards reducing its global burden. And this is all about cervical cancer. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.